Why do I need an annual wellness visit?
That's a great question. Annual Medicare wellness visits are something that are very, very important that Medicare has put in place for us, your primary care physician office, to be able to set aside a special time, just one time a year, where we can assess all your other medical problems that we may not have time to address on an ongoing regular basis. Sometimes you have chronic problems that are very, very stable and don't become the forefront of a medical visit because unfortunately we're too tied up taking care of the acute issues or injuries or acute illnesses that you have when you come to your visit. So to avoid some of these distracting times, Medicare has put in place the Medicare Annual Wellness Visit, where we are able to sit down one-on-one with you as a provider to the patient, go over any concerns that may not have been addressed in the past or any concerns that have been addressed but haven't been reviewed in a long time, and then sit and document those and submit that to Medicare to allow Medicare to have a better picture of your overall health status.
Why isn't that addressed at my regular follow-up visits?
That's a very good question, and that often comes up with a lot of patients. Well, why aren't these things taken care of at every follow-up visit? Well, honestly, there's simply not enough time in today's environment to be able to capture every single problem you have ever had, even though it's been relatively stable or very stable for a long period of time, perhaps years. For example, somebody may have had an amputation that even though it's being taken care of by an orthopedic specialist or some other provider and typically not addressed within the confines of your primary care office, Medicare still needs to know about that, and we have to attest to that every single year so Medicare can make sure they have adequate funds set aside for your care based upon your individual problems. So throughout the year, we simply don't have time to do that at every single visit, and this is why Medicare has set aside the Medicare Annual Wellness Visit as a specific time and place for us to be able to capture these certain conditions so they don't get lost in your medical chart.
So what happens during my annual wellness visit?
Great question. So what happens during a Medicare Annual Wellness Visit? So a Medicare Annual Wellness Visit will look very much and feel very much like a regular office appointment. Your provider will still come in the room, greet you as normal, your vital signs will be taken, we are going to go over each and every one of your medical problems, and you may be surprised. We may find some problems that possibly Medicare has listed in your medical record that are completely inaccurate. So that's going to give us a time to sit and discuss the problem itself, also possibly determine that that may not even apply to you, so we can relay that to Medicare to know that that condition either no longer applies to you or should never have applied to you. Otherwise, the visit will look very much the same as a regular office visit. You'll undergo an examination, possibly have laboratory work ordered at the end, and we can address your medication concerns at that time. So once again, very similar.
But I don't want to pay another copay.
And that's a great point too. A lot of patients are really frustrated because they see the Medicare Annual Wellness Visit as, oh my goodness, this is just another time for me to have to go into the office and I'm going to have to pay a copay or pay some fee of some sort. And the answer to that is that you absolutely have no fees. The Medicare Annual Wellness Evaluation, because it's something that Medicare finds that is so important for you and your health, they do not charge copays or have us collect any fees for that. So there is no fee associated with your Medicare Annual Wellness Visit.
Well, I'm seeing multiple specialists. Why do I need to do this at your office?
That question often comes up as a lot of patients are often seeing a lot of specialists for their other medical problems, possibly a cardiologist, maybe a kidney doctor, or other specialists. And the thought is that aren't these people capturing this data? And the answer to that simply is no, they are not. The specialist is very hyper-focused on your specialty problem. So if it's the cardiologist, for example, they're really only concerned about your heart and not concerned about what possibly your diabetes or other medical problems are and how they're affecting your heart or other parts of your body. The same thing with the kidney doctor or the eye specialist. So yes, this is something that we will do in a primary care office that a specialist will not be doing, and it once again gives us that opportunity to capture and record diagnoses and report to Medicare that may not have been captured before or may be on the verge of being dropped off the Medicare rolls, so Medicare can appropriately plan for your costs.
So how often do I need an annual wellness visit, and what makes it different from a physical exam?
That's another very good point, that patients often confuse a physical exam and an annual wellness exam. Well, first, as it's an annual wellness exam, it's done once a year. It's not done sooner than that. And as I said in previous discussions, there's no copay associated with this. Also, it does look quite a lot like a physical, where the provider will see you in the office exam room, vital signs will be taken, the provider will do an examination, will discuss your health concerns with you, but this is more of a preventative focused visit where we're looking at your current medical problems and looking at ways to help prevent more problems down the road. Also this gives us an opportunity to give Medicare a complete and accurate picture of your health status so they can plan accordingly and help us better serve you.